Hi, good afternoon, everyone. At least it's afternoon here where I am on the East Coast. Maybe it's still morning for some of y'all, but welcome to ST135. This is your Unit 1 discussion. Today we're going to be talking about furniture in the operating room. So, a little bit about me, since I haven't met some of you. Some of your names might have been a little familiar in my grade book, so if you've seen this about me, well, here's a refresher. I have been a surge tech since 2008. I graduated from a certificate program in my local community and have been practicing in some capacity or another as a surge tech ever since. So I practiced full-time as a surge tech until 2012 when I got married. And then I started teaching. A friend of mine was the program manager and offered me a position as an instructor, and it worked well with my schedule. So I started teaching in 2012, and I've been teaching pretty much full time ever since as a surge tech instructor. I later decided to go back and finish my college career and get my associate of applied science in 2018, and then my bachelor's degree in 2021. So I just finished that up a few years ago. Considering a master's, we're putting a pin in that though. I do have two kids. These are my two little goobers over here. They're actually a little bit older now. That was a couple years ago. I also have two dogs. So that's just a little bit about me. Sometimes it's nice to put, a face to the name behind the screen on your program here. So, all right. So here are our first assignments for Unit 1. Try to do this for you every week so you can, just a reminder, keep up on your things. There are a ton of assignments in here, like some of your other like larger credit classes. This is a 1 credit class, so typically the load goes with that. So you have a Unit 1 discussion that technically should have been due yesterday. These discussions are going to be done on Thursday, so that's just the way my schedule worked out this quarter. So make sure you get those in on Wednesday. That gives you plenty of time to respond to 2 of your peers by Sunday for full credit. Make sure you get both of them or you'll get points taken off. So watch those discussion boards. A lot of times with those, what I end up having to take points off for students is not responding to your peers or not citing sources correctly. So I'll try to remember to put a link in maybe the announcement section of where you can easily find how to cite sources in APA format. That tends to be a problem. You can't just post the link and nothing else about it. You have to cite that properly. Okay. All right, so our objectives for today, we're going to be talking about different OR furniture or equipment that we have. You're going to understand how that works with starting with the basics, and then we'll talk about some of the specialty equipment that you might see. So you're going to make sure you have a good foundation of these things because you'll be tested on those things, and you just have to know what should be in your operating room before you can do your cases. Okay, so our furniture is literally more furniture options than Value City furniture, okay? There are so many, and not an exaggeration, pieces of OR furniture and equipment. There is something for every single specialty. So it can be a little overwhelming. We're going to start with the basics. And then as you work through some of your more specialty procedures, you'll pick up on some of the others. I couldn't list all of them here today. But here's just a picture of, just a basic operating room. If you've never seen an operating room, this is very basic. Actually, probably a little old. I just noticed along the top here is wallpaper border. That would never happen in today's society. You won't, you're not allowed to have that. I just noticed that. But you're going to have an OR bed. You're going to have this type of equipment for, this is electrocautery. You might have something for plugging in your camera for the laparoscopic cases, maybe something to insufflate the abdomen, a lot of rolling stools or different types of chairs, a lot of things on wheels. That way you can move it around depending on the case or the patient positioning. And this big thing up here is for anesthesia. It's our anesthesia workstation. All right, so a couple more OR layouts I have for you. Just every facility you go to is going to be different. So don't get, pigeonholed into thinking You know, it only looks one way, it doesn't. And you might have like 10 different OR rooms at one hospital and they're all laid out slightly different. That's just how it works. And they do that sometimes on purpose, depending on the type of case they do in the room. Might have something, you know, this room right here might be specific to orthopedics. Okay, that might just be all they do in there. So they keep that type of OR furniture and equipment there. So if you try to do maybe a cystoscopy case in here, you might struggle a bit. You might have to go get things to make things work, right? So the center of the room is almost always the bed. You're typically anymore in like more up-to-date OR is going to have things hanging from the ceiling like OR lights, um, monitor screens of different varieties. A lot of outlets and things can hang from the ceiling. You got a lot of things to plug in. And like I said, a lot of things move around on wheels to make it adjustable. All right, so how does this pertain to you as a surge tech? What are your duties when it comes to OR furniture? You have to know the basics to know what should be in a room, so you know what's missing if it's not, right? And you have to understand like the basic common positionings for patients. You know, you got to think ahead, like if this patient is having this particular surgery, what kind of bed are they going to need? Does that surgery require a special positioning or a special positioning device? So you have to understand your surgeries. So that allows for planning and preparation ahead of time. You could always ask somebody if you don't know or if it's not on like the preference card. Sometimes they're listed. Um, and you have to make sure that you're doing that in a way that prevents accident or injury to you or the patient. You want to make sure the positioning device is correct for the procedure and that it will be safe and comfortable for the patient if it's directly in contact with the patient. Question any potential risks. You should always do this, right? Always question because you are the patient's advocate. And that is true when even when we're talking about OR furniture, making sure you are watching for everything and communicate. If the doctor maybe in passing in the hallway says, hey, I need this set of stirrups for this next case, but you're going to go to lunch, communicate that with the room that is going to have that case. Just pop in and say, hey, Dr. So-and-so says that they need this. Make sure you get those. But communication is super important. All right, so here are some of our basics, our regulars you're going to see in pretty much any room, any OR room you go into. This is one of the most common pieces of OR furniture. This is the back table, okay? So all of these look right now, they are non-sterile because they don't have a sterile drape on them. Again, look at the wheels, right? They're everywhere. So the top is your working area that you're going to cover with a sterile drape or like a back table pack. And if you wanted to like store extra trays down here or something, you could during the case. This in the middle here is your basin stand. These can come in a single basin like this, or there could be two attached to the same thing, a double basin. You can put fluids in here. Maybe you have extra sterile water to rinse instruments. Maybe you have a really big specimen that you're taking out and you need a big basin to put it in. That would work. So they make special basin that are disposable that aren't necessarily metal that would fit in here as well. That would come pre-packaged and you could open that basin in a sterile manner so that it drapes the whole thing. Or these metal ones can be reprocessed and placed in here and sterilely opened in that as well. So another good view of a layout, but in the middle is the OR bed. There's a lot of different varieties of OR beds. It's pretty basic right here. We'll talk about some of the features to the OR bed here in a minute. This down here in the right corner is your kick bucket. So it got its name because literally it gets kicked around. Okay. So it's kind of hard to tell in the picture, but it's smaller. It's about shin height, not even to your knee. So we typically in my area, we will put a red biohazard bag in this, just down in it, and we will throughout the case throw our soiled bloody sponges into the kick bucket. That's where your soiled sponges should go. Okay, they're not supposed to line up your back table. You should keep clean and dirty separate. So whenever you're done with your lap tapes or whatever it is, throw it in the kick bucket for the circulator to organize and count later. Okay, this last guy over here is the Mayo stand. This is another super common one. Some facilities maybe use the back table for throughout the case, maybe more than the Mayo stand, but where I'm at, we typically use the Mayo stand for the case, the things we need immediately. So this gets draped with a special Mayo stand drape. It has down here a little foot, like it's a button that you can press and it will lower it. So when you grab the sides of this tray, this Mayo stand tray, and lift up, it will typically just stay where you lifted it to. You don't have to press the foot button for that. But to lower it, you do need to have this foot button. So you're supposed to stand on this post side closest to that foot button, and this tray gets, after it's draped, pushed over the sterile patient, the area draped on the patient. So anything you need the most throughout this case, like immediately or maybe a lot of times back and forth, you need a bunch of hemostats, whatever, you're going to put on your Mayo stand, okay? And if you have instruments that maybe you don't use quite as often, or where your tray, you could just leave it in the tray and leave it on your back table. So on your back table, you'll have instrument trays, maybe your stack of drapes until you're ready, your sharps box, maybe some other smaller basins with medicine in it, your lap tapes, towels, extra supplies would go here. Now with this Mayo stand, I will tell you, speaking from experience, that sometimes when you're in the case and you get like a little bit tired or antsy and you're putting your foot up here on this little bar, be careful not to put your foot on the button, okay? Because if you do and you're not holding onto the sides of this tray, guess what's going to happen? That entire Mayo stand with all of your instruments on top are going to just fall super fast, and it's going to be loud and things are going to fall off your Mayo. And if it's over top the patient, and maybe you have this over the patient's feet, you could potentially hurt their feet. Like think of a heavy tray falling right on the top of your toes. That's going to hurt. So be very careful about putting your foot on this button if you're not ready for it. All right. So some other things you might see in pretty much any room that it could just go back and forth. Sometimes like if I'm in this room, but the room next door has a procedure where they have to sit, they might have to come steal a couple chairs, right? So this is just a rolling stool. Some procedures require the surgeon to sit. And theoretically, if one person of the team sits, everybody should sit. That's by the book. You want to keep everybody on the same sterile field, same level. So you may require a couple extra stools. So not all cases will use a stool like this, but they're usually available. This here in the middle is called what we call a step up or a step stool. Sometimes, and it depends on like what you're doing in the case or even your surgeon. If you have a surgeon that's like 6'7" and you're only 5 foot tall, okay, the patient's bed has to be raised pretty much for the surgeon so they can operate and see and not kill their back bending over. So you might have to get one or two step ups. These actually stack, but be careful when you stack two that you don't step off the back and fall. So you could even like put one here and put two on this stack that you like almost like a little steps, right? So you can see, because otherwise you're going to be reaching into the sky. And then this is just a generic type of scope cart. It has a monitor, but it can also hook up to other monitors hanging from the ceiling. So anytime we do a laparoscopic procedure or even an arthroscopic procedure, maybe in orthopedics into the joint, you need to see what you're looking at if you're just using those small ports and trocars. So you'll have something to hook up to for the video picture and then another one for a light source. And if it's like joint or something, you might even have something for irrigation attached as well. And a printer, you can print pictures. They take pictures. So here's your basic OR bed. It's going to look something very similar to this, okay? This brand right here, the Steris Amsco, is super common. So they're all going to have pretty much basically the same features. So they're all padded because obviously we want to protect the patient. It's not going to be like, a memory foam sort of bed, but it's going to be semi-comfortable. It does have a remote. I don't see it pictured here. It was in the other one. It's like an oversized TV remote that has a bunch of buttons. It's going to raise the head, lower the feet, raise the entire bed, or even tilt it with feet up or feet down for Trendelenburg and reverse Trendelenburg, different positions like that. It can have head and footboard attachments. You can even add an extra like footboard here so they don't slide off. This where the head is, can detach and move to the foot or vice versa if needed. This perennial cutout is this little hole right here, the perennial cutout. So if you're working in the perennial region or even doing something OBGYN, DNC, hysteroscopy, something like that, where you have to have access to the bottom, they're gonna sit and you're gonna tell them that you need to position them right. It's gonna feel like they're in the hole, but right above that hole is where their bottom should be. And then when they're asleep, we're gonna lower or remove this section, lower it, and then add stirrups, and then their legs will be in stirrups. So this just gives a little bit more access to that area. Floor locks you always want to make sure that is locked in place before the patient is moved onto it because it does slide. It does have wheels under this. You don't want to cause a patient to fall. And then side rail locking system are these metal bars here. So that's what this arm board is attached to. There's like a little mechanism, you can't see very well here, but a little mechanism that you can like reach under and grasp to remove it from this bar or add it to the bar. Same with the stirrups, if you had stirrups here. So it locks onto that side rail. And then another feature of the OR table is a radiolucent top, which means if you had to bring in an X-ray machine or a C-arm and you need a picture of maybe a broken bone or something on the patient, there's a piece for the C-arm that goes from the bottom to the top. This radiolucent means X-ray will pass through it easily. Now, if it's radiopaque, the opposite of that, the X-ray would not pass through. You wouldn't be able to see what you were trying to look at. So radiolucent lets it get through the bed, the X-ray, to see the bone or whatever it is you're working on. Some other attachments you might see just to your basic OR bed. Here's an example of stirrups. There are a lot of varieties of stirrups. Some of them go up really tall and curve over. We call those candy canes if they do that. Some are really big and bulky for the entire leg. Your calf is just going to rest in these. So we don't see these quite as often in the OR. This is more like maybe a doctor's office type of stirrup. Ours are a little more secure. You might have individual like padded leg areas. These up here are shoulder braces. This special little bar you can it protects like the patient's like from the drape or something like that, and then arm boards. So there's a couple other options here as well. Limb holders. There's a lot of different stuff for orthopedics. All right, so preventing injury when we're talking about any type of bedding or anything the patient is going to be in direct contact with, we have to consider protecting the patient from any injury. We don't want to cause more damage, right? We want to protect them from that. So consider the nerves and blood vessels in the area, making sure they're not compressed or cause a compression injury. When we're putting them in those things, you don't want to like slide them. You want to place them and put them where it goes instead of sliding it to the area. Because especially older patients who have very thin skin, you can cause a shear injury where the skin literally just tears, and that's nasty. You don't want to do that to a patient. Pressure injury, if you don't pad, like this picture shows a lot of good padding. If you don't pad these areas of bony prominences like the elbow, the heel, the backbone, maybe even the knees if they're upside down, you can cause pressure injuries. You can even lead to lack of blood supply to those areas. So always pad any bony prominences. If you don't know how to position a patient, you could lead to skeletal injury. You could literally break somebody's bone or dislocate something. You don't want to do that. Respiratory compromise is a concern for certain positioning, like this patient is laying prone. People who are prone are more likely to have respiratory issues because you're laying on your chest and there's less room for your chest to expand. So these blue ones down the side here are like axillary rolls, and they also take some of that pressure off the chest. Eye and ear injuries can be a concern for certain procedures. This one, for example, if they're prone and laying face down, you obviously can't just lay their face against the mat for 8 hours or the bed for 8 hours. So they put their head in a specific way that there's no pressure on the eyeballs or ear if you were laying on the side. So orthopedics and neuro, I would say, this is just my opinion, probably have the most specialized equipment. I could be wrong, but they have a lot of special things. Here's a good example of one, the fracture table. So for these cases, you can't just use a special or a normal OR bed. You can do maybe a lower extremity fracture, or maybe you're replacing the hip through an anterior approach. You can use a fracture table. Sometimes that's called a HANA table, where you're putting both legs in special little boots with some traction. There's a padded bar in the perineum and a safety strap across the waist. So this is one, HANA is, I think, like one of the brands. There's others as well. So this is an attachment for the regular bed. This is a hand table attachment. If you need to do like a carpal tunnel or maybe a Dupuytren's contracture or something on the hand, whatever, it could even be vascular in that sense. It doesn't have to be orthopedics. Anything on the hand or maybe even lower arm could be done with a hand table attachment. This particular case might require the surgeon to sit. You can add this to the regular bed too, a total knee support. There are a lot of different ways to support the knee if you are working on the knee joint, maybe replacing it. The knee doesn't just lay flat for the whole case. It's usually bent, extended, and then relaxed a lot of times. So sometimes they need that knee support underneath it. Another common one is the pegboard. This one is kind of weird, right? It gets placed on top of a normal bed. It literally is a piece of plastic with holes in it. Okay, it's heavy duty plastic, but there's different peg attachments that you're going to put in specific areas along the patient to keep them in a position. It also needs to be done with this very big gel padding, because you can't have this patient laying directly on that plastic. That would cause a lot of injury. So even the posts are padded. The surgeon will be in the room for this type of positioning. You want their input on how they want that patient positioned. So you could be doing like a hip procedure here and need them up on their side. Some other things you might see in the room, different furniture pieces, the stretcher. So a lot of times we do all the cases on the OR bed or a variation of that. You know, every once in a while, the surgeon will be like, I can just do this on the stretcher. It takes 5 minutes. It's fine. So they won't transfer them to the OR bed. So they'll come in on their stretcher that they brought them from from the holding area or something to the OR on a stretcher, which is what this is here in the corner, right? So you need to know how to work the stretcher. It has a lot of the same features as the OR bed, except it's not plugged in. It's not electric. It's got like foot pedals to adjust the height of the bed. Sometimes patients come in a wheelchair every now and then. And if they're maybe just having a mold removed or something, we might just wheel them in a wheelchair, depending on your facility. Lateral transfer devices are things that are going to help patients move from, let's say, this gurney or stretcher over to a different bed or an OR bed. Sometimes they can't help us move from bed to bed. They could be unconscious, incapacitated, whatever. So we have to safely move them from bed to bed. One option is this air assisted transfer system. That's what this purple thing is here. That's called a hover mat, right? It inflates, it helps slide them over, and then you can deflate it. Transfer boards and roller boards are very similar. Some of them are like thinner pieces of plastic. The roller board like has something over that rolls over top like these things. So as you move the patient, it rolls with it. Mechanical hoists are far less common. You might need something like this if you have a bariatric patient, and they're a lot harder to transfer. Okay, and then we have special procedure rooms that may require some other different furniture and equipment. Outside the OR, you might have a cystoscopy room, you might have a cath lab, you might have a minor procedure room for smaller things. Not all places have these. You might end up dealing with the emergency department. Uh, every now and then you might have to go down there, but all of these things you might see something slightly different that you might not have in the OR. So cystoscopy rooms, I would say, is maybe the room that is most likely that you're going to see, I would say, as a surge tech. And they're set up, like I said in the beginning, they're set up to just do those cases. So you don't have to move a bunch of those furnitures around. Because cystoscopy, you require like stirrups, a special drainage bag, something to drain the urine in. There's a lot of things to consider for cystoscopies. So I just wanted to show you this quick little video because I liked their OR. I thought it was cool. They have some neat features in here, and they talk about some of their equipment and furniture that they have at St. Peter's Health. This might be about 2 years old or so, but this is pretty up to date, so I wanted to show you this.
I'm Meryl Taylor. I'm the robotics coordinator and a circulator here at St. Peter's Health. We have all sorts of new features here in our new operating suites. The patient can have a different experience now with the newer rooms because we are able to use newer technology to take care of patients. For instance, the robot. We wouldn't have probably been able to utilize that with our old room. Now we're able to do different surgeries that we weren't able to offer to the community prior to this. We upgraded to become the state-of-the-art OR in Montana. We have the newest, latest equipment. We have a routing system that we are able to hook different OR equipment into. When you're having an arthroscopic or laparoscopic surgery, the camera that goes into your body, that picture is routed to these screens so that the surgeon can see what they're looking at, and so can everybody else in the room. They have a great crisp 4K picture. One of the lights has an in-light camera. We're able to route that so that the people outside of the surgical field can see the operation. There's two different, what we call greetings that we play so that when people come into the operating room, it's a little bit more welcoming. It plays calming music, or we can play music that the patient requests when they come in. And that way they just feel a little bit more at home. It's better to see a nice rabbit or a river than all the instrumentation and all the strangers staring at you. We have these state-of-the-art lights that are LED. That means that they don't add extra heat to the surgeons to the field, so that when they're shining on the field, they're nice and cool. These smart readers in the room are able to tell us what our airflow is, the temperature, the humidity. We have a new air handler that's able to handle all 6 operating rooms on the same air handler. The positive pressure allows all of the air to move away from the field, so there's nothing that is going to float back into the field. We also have these new pass-through cabinets. If we need additional instrumentation or supplies, we can call out of the room and a person in the sterile core can come and put a item in the pass-through, close the door, then we can open it from the operating room side and not disrupt the airflow in the OR. We have green lights in the room that when we're doing any type of arthroscopic or laparoscopic surgery, we are able to have those vessels and that anatomy kind of pop a little bit more because it shows the redness better. We have ultraviolet 3 lights that turn on when there's nobody in the room that kills the germs while we're not doing anything. So there's always antimicrobial work being done in the OR. With this new renovation, we're able to use newer technologies in the spaces. We can just utilize all the technology that's out there.
Well, hopefully you were able to pick out some of those furnitures that we had just talked about. There was some that we hadn't, like the robot, is becoming commonplace anymore, really, as just being a staple in a lot of ORs. So you'll see that a lot of times it still requires a little bit of a special training to work on those robots, but that's definitely something you could do. All right, so if you have any questions, please feel free to reach out to me. Here's my email, mludwig@herzing.edu. Um, my office hours are on Tuesday. If that doesn't work for you, we can try to work something else out. From 1 to 3, I'm on the East Coast, so I tried to make it a little bit later for some of you that are on the West Coast. I know several of you are, so reach out to me if you ever have any comments or concerns, and I'll get back to you. All right, have a great week.